All right, so we're here with Kimberly, and she's been running and has a history of shin splints. This time a little atypical. It's kind of on the back side of the calf. When you're running, how 0 to 10 scale, how high does it get?
It gets to about an 8.
Gets to about an 8. And then when we do one specific test, which is down and in, and hold that right there. Harder. So it's weak, and then what's the pain level when we do that test?
It's only about a 5.
About a 5 when we do the test. And of course the weakness you can visualize too. So, okay, so the first thing we found was the tibialis posterior. I get so confused. We found up and out was weak and still weak, and we stretched the muscle, kind of like when the doctor taps your knee with a hammer, and it didn't strengthen, so I had to treat a local injury first. So the test is still weak, and then we went through her whole system. I just saved the time of, checking that. We checked through and found something related to thymus immune. We challenged against virus. We got a weakness there. We found the remedies, so we're going to just treat that reflex. So if you'll set this over here, just relax down. So treating is just massaging. I think, I did a preliminary check, I think this is going to strengthen those weaknesses.
Okay.
That this is really a pattern that has to do with inflammation in your system. So now back, up and out, hold there. Still a little bit. Can you tell the difference?
Mm-hmm.
And let's go down and out, hold there. That's really solid.
Mm-hmm.
Feel that?
Yeah.
Like I'm cranking on that now. And here's the one that caused pain. 5 out of 10. Down, in, and on the lift up. How's the pain?
The pain is probably about a 4 now.
About a 4 now. We haven't treated the pain though. Next thing I'm going to do is just go through the muscles here. Again, same thing. Kind of tell me what is ouchy. Usually your face will tip me off. Starting to get a little bit.
It's getting more tender as you go up. You're not putting any more pressure right there? Okay, right there.
Right there is kind of the...
Yeah.
So it was pinpoint on the other end, and this was fairly pinpoint also.
Yeah.
Go all the way up. And then here is the pain gating technique. This is kidney bladder point right in here, bladder something or another. I'm not an acupuncturist. You're going to tap. Okay, so go ahead and do that. And what you'll do at home is you'll touch and tap. So you'll put your hand on it like this.
Uh-huh.
Right now I'm going to go ahead and touch it for you.
Uh-huh.
And actually do a little muscle work with it. But you just keep tapping. You can just, about a minute. Is that tender in there?
Yes.
When you check through, you found a pinpoint here. You can stop now. Pinpoint here, so you're going to check that again.
Okay.
And then we found a pinpoint up here. You're going to check those 2 spots again.
Okay.
After we treat it, you pull down on your ankle.
Okay.
And doing it yourself, you just grab the ankle, pull down.
Okay.
You don't have to come to the other end of you and do it. All right, so now push down and in. So just through kind of warming up the muscle, through testing, it came down from a 5 to a 4. Let's see what it does now.
I didn't feel much pain at all.
So 0 to 1 now?
I'd say it's about a 2.
Maybe a 2, so lower, definitely.
Yeah.
And I don't know if you could tell, but I put considerably more pressure on it. Like I was, I was trying hard. I was like pushing hard. So that's and hopefully the camera can kind of appreciate that. So do what you did before, where you were just kind of moving your ankle around, and see if you found a position you could get some pain.
It actually feels a lot better right now.
A lot better right now?
Yeah. That
Okay.
was the position that it hurt the most in.
Can you still get a little bit there?
I'd say it's probably a 1.
About down to a 1?
Yeah.
Okay. So stand just facing me. So you impressed with this voodoo
Yes.
so far?
Yep.
Step back on this. Okay, so I'll give the instructions for what she needs to do for the next week. Go on some runs. We'll see what happens. Okay? You'd feel it, so.
Yeah.
Okay. Give me the update. You said really good.
Yeah, I'm feeling no pain right now. I would say that
0.
it's, yeah.
And remind me, like how long had that been going on?
That had been going on since about May.
And it's August.
Mhm.
And you've been out running.
Mhm. I ran last week a couple short runs, and then I ran a 7-mile, which normally would be enough to make me hurt.
You get it, and then nothing.
And I'd say that during the actual run, I had a little bit of pain, maybe a little stiffness, 1 or 2.
Okay.
And
Compare that to June.
to June, I would say, if it were an 8 or 9, I wouldn't run. It's
Sure.
not excruciating, but I'd say while running it would be a 4, and then after running 6, 7.
Okay.
It really hurt afterwards, and I would come home and have to ice and just lie there and feel sorry for
So
myself.
now it was 0 after.
Yes.
Okay, that's really cool.
Yeah.
And you've been very consistent checking.
Yes.
Has the tenderness gone down? Like, is it harder to find those tender spots now?
Yes.
Yeah.
Yes.
That's easy, isn't it? That's
Yeah.
kind of what this is all about, is like teaching people some simple ways that they can help themselves. Like, you don't need to know all the anatomy. I know very little about acupuncture stuff, but I know these face points, and I know how they travel through your body.
Mhm.
So, yeah.
Yeah.
And profound impact. Now,
Yeah.
I saw somebody else yesterday, and there was a little piece, and it was just in a different area,
Mhm.
and there was a little piece, so it had started to come back on her,
Mhm.
over the 10 days we checked her. So that's just a sign that maybe we found them all.
Right.
So maybe there's nothing to do today. Up and out. And that's good. And down and in, down both directions. So down and in. And it was that one that caused the pain, right?
Mhm.
So we can crank on that now, down and out. Right there. And right there. Okay. When I touch it, is it still tender?
It's a little bit, yeah.
Still a little bit tender when
Yeah.
I pinch. So that's still there. So what I did was pinch,
Mhm.
activate pain reception,
Mhm.
and it created like a neurologic consequence. We got a stress response, basically.
Yeah.
For that, we did number 3. So right inside the eye. So you go ahead and do the same side as the pain. So you tap, 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 tap. So this is how we just kind of reestablish the gating. So after something has been communicating pain for a long time, the pain starts to become an entity in your brain, where a phantom limb is probably the classic example of that. So you don't even have a hand, but you feel this hand pain. Well, the experience is in the cortex, in the primal cortex, where there's a map of your body, and it keeps firing. And so this actually helps with that.
Okay.
So it helps to dampen the perceptions of pain. And it also sends down here, so it helps with the healing process too. So
So you're massaging at the same time as doing this?
yeah. And you can just touch it and tap.
Uh-huh.
You can move it and tap.
Uh-huh.
So you can tap like if it hurt when you really pushed your toe down.
Uh-huh.
You can push and tap. As long as that muscle is strong. If the muscle is weak, the pain will keep coming back. But if it stays strong, which it has, good. So now I can pinch. Any change in the tenderness?
Yes.
It's come down.
Yes.
Whereas you did kind of flinch when I pinched it.
Right.
And now I pinch it and it's not there. So that's gone. That's it. So you can keep checking those spots.
Okay.
I just finished out the tincture that you had. I'm not getting that need anymore.
Okay.
Yeah. Always call if you break it again.
Okay.
But it looks like it's fixed. Cool, hey?
That's great.